Good afternoon, everybody. Uh, Again, I am starting this series of session. 3 sessions I will take on the telemedicine. Today, first session, that is the future of healthcare is digital, scope and opportunity in telemedicine. So, uh, just brief about the objective of today's session. Understanding the telemedicine, COVID-19 and telemedicine, scope and opportunity in health sector, particularly for the telemedicine. So this is the very interesting topic, and everybody like to understand, like to join. Uh, just I had a talk with the Clarinet team. They have asked one question: How many of you have used the telemedicine till date? So almost 50% out of around 300 participants replied they have used the telemedicine somewhere other way. So this is good that already people are using, and we try to understand what are the scope or opportunity. And next 2 sessions I will take a public health role of telemedicine in public health, and one more is a role of telemedicine in healthcare delivery system. So these are the very interesting topic, and it has a very good opportunity. You must have listened my previous talk on the India's economy, upcoming economy of 5 trillion economy. On this, I have took a series of the session. Similarly, this year is also very good business ideas. You can go ahead with this, and you can plan something. And anywhere you need a help of myself, you can mail me via email. Lastly, I will give my mail ID also. So, what is telemedicine? First, the term coined in 1970s, but it is said that before that also people were using the telemedicine, means healing at distance. See, this is very important. The medicine plus tele, we are adding the tele plus medicine, that is a medicine at the distance level. We are trying to heal at the distance, and this is a telemedicine concept. Now it is renamed. Many people say M Health, few people say the Tele-Health, so few people say the M Health. So there are different names now upcoming for the telemedicine, but popular term is a telemedicine in this area. WHO defines the delivery of healthcare services where the distance is a critical factor by all healthcare professionals using information and communication technology for the exchange of valid information for diagnosis, treatment, and prevention of the disease and injuries, research and evaluation, and for the continuing education of healthcare providers, all in the interest of advancing the health of individual and their communities. See, this is very important, very complex but simple. Ultimate goal of health is to make a person happy and healthy. So to achieve this, we are trying at the different way. Now technology advancement made us this telemedicine very easy comparison to the past. There is one more definition, that's a delivery of healthcare services where the distance is critical factor by all health sector professionals using the information communication. This is almost WHO definition. The delivery and facilitation of the health and health related services, including the medical care provider and patient education, health information service, and self-care via telecommunication and the digital communication technologies. So the words are very important. Services, medical care, provider and patient education, health information, self-care, digital communication. These are the keywords in the telemedicine, telehealth. Why do Bharat need telehealth? See, this is very important. India, still, it is a complex country. Still, as per 2011 census, 66%, almost 66 to 68% population still living in the rural area, rural and tribal area, difficult to reach area. You can say 32% people are living in the urban area. And you know the disparity in the healthcare services. Majority of the services concentrated in the urban area. We all know as a doctor, majority of the doctor like to settle in the urban area, very few in the rural area. So rural area are challenging for the services for the government as well as private both. So this is a very important area. With the help of the telemedicine, telehealth, we can achieve this quality of the health services to the all area, all the corners of Bharat. Telemedicine can save cost and efforts, especially for rural patient. This is very important. In the rural area, you have experience for the little bit small problem of the medical, they have to rush to urban area. See, this is very important. If we have some telemedicine concept, tele stations are there, they can rush to the tele station rather to rush to the urban doctor. So this is very important. Telemedicine can save the cost and effort, especially rural patient. Maintenance of record and documentation. You all are the doctor having the experience that when patient coming to your OPD, you are asking the past history. Patient will say, sir, I forgot to bring the document. Okay. I did investigation in the past, but today I forgot to bring. See, this is very commonly observed gap in the service. So this telemedicine help to track all the records and documents for the patient, clients, and doctor both. So missing out advice minimize. Written documents increase the legal protection of both the parties. See, here in the health, telemedicine, you are writing everything on digitally. So both the party, doctor and patient, both are having the evidence that what I have written and what he read. So there is a legal issue are reducing. Many people are afraid, but here I say legal issue are actually less in number with the help of the telemedicine. Telemedicine provides the patient safety as well as the healthcare worker safety. So we had experience in the COVID. See, nobody likes to directly approach the patient. So telemedicine was popular and started to be popular with the COVID. We will see that part also. So this is very important, not only patient safety, but the health worker safety. You all know hospital acquired infection is very common. Once patient admitted in the hospital, if is more than 3 to 5 days admission, there are very high chance to get the infection. So hospital acquired infection also reduced with the help of the telemedicine. In some cases, until you require to admit patient, you have to admit. But you can minimize those unnecessary admission with the help of the telemonitoring. India's digital health policy, this is very important. Government of India has already published the digital health policy that advocate the use of digital tool for improving the efficiency and outcome of the healthcare system and put a significant focus on the use of the telemedicine services, especially in the health and wellness centers. See, this is very important. Everybody must aware about this health and wellness center. Arogya Mandir, it's popularly known as now. The older name is the sub-center and primary health center. Now government has converted the sub-center and primary health center to the health and wellness center. It is newer name as Arogya Mandir. So this is a very interesting concept upcoming, and they are all connected with this telemedicine concept. So it is government is also supporting this telehealth concept in the Bharat. COVID and telemedicine. This, I think almost 50% people who joined that survey said that they use the telemedicine. COVID-19 pandemic has changed the doctor-patient relationship. This is very important. Just recall the COVID pandemic and during lockdown and post-lockdown phase, your epidemic phase 1 of the India, phase 2 of the India, 3, 4. So ups and downs going on, and the way the doctor-patient relations changed, very important. We need to understand. See, it is that the will prevent the emergency room for being overcrowded. No need to rush immediately directly to the hospital. You can talk with your family physician telephonically, use of telehealth, telemedicine, and ask the help. If the doctors say, then only to the rush. Otherwise, everybody rushing to the emergency room, it is very difficult to manage the patient. And that was happened during that time. Gradually, it come down. So we can prevent this, and that was prevented not only India, all over the world. We'll limit the exposure among the healthcare worker to infected individuals. So because of overburden, you have seen the many videos, healthcare workers were almost fatigued. They are not able to cope up the workload. So because of your unnecessary rush, you can directly contact healthcare worker or you can doctor through the telemedicine, and you can minimize doctor's exposure and your exposure. We'll cut down the use of the mask, gloves, gowns, worker by keeping the patient at home. This is also very important. Lot of waste, biomedical waste we produced during that time. So in US and China, telemedicine has already been adopted to tackle the COVID-19. This was a slide I have taken from the during that pandemic area, but we all also use that part. See, this is very important. And see the third point, role of family physician and teleconsultation. This is very important. We, as a my age people, if they recall their childhood days, everybody must have their own family physician. I know my family physician who was giving treatment to my entire family. If anything happening to my family, we rush to my family physician doctor. So this is very important. And this concept almost eliminated since last 2 or 3 decades. You can see when I started my medical education, and since that time, I am observing this family physician concept is gradually eliminating. And this is very dangerous. We should understand it. We should not rush directly to the all consultant. Every family should have at least one family physician. So in your day-to-day small issues, you can contact to your family physician, and whatever family physician say, you should follow, and they will refer to appropriate sites. So this is very important. You need to trust one good family physician, and your entire family can be healthy. So this role of the family physician is redefined with this COVID, and we need to understand. And this family physician can be used as a teleconsultant. So you can need any help, you can directly contact. You are all record with the family physician, and they will help, and they will support, and that particular family physician will refer you. Home-based care and telemonitoring. This is very important. If you have any chronic disease, geriatric patient, or anything long chronic support required, you can be monitored with the telemonitoring by your family physician or any hospital. So this COVID has changed the concept, and we need to understand now we have to continuously adopt this concept. Now come to the business point of view. Global telemarket. See, the global telehealth market size was almost 41.01 billion in 2021 and is predicted to grow around $225 around billion by 2030. So this is very important. Huge growth is upcoming by 2030. There can be by application, by end user, by mode of delivery, by product type. So this all are, see, it is said that CAGR is 18.81%, almost 20%. Cumulative average growth rate. This is very important. Huge growth rate. Everybody is saying that the market is now in downtrend. We are the bearish, but the healthcare market is not going to be a bearish. It must be a bullish. So all the doctors have a good opportunity. You can use this telemedicine. You have to develop your skills. Keep in mind, you need to develop your skills. Otherwise, you will be outdated. See the Indian market, you can say a Bharat telemarket, 2022, 1.1 billion, and expected by 2030, 5.15 billion. 5 times it is going to be increased. Already we integrated the chatbot robots on the online portals. There are many online portals that are available. They are using this type of the thing. Smartphone application for acquiring the personal and health-related information. Government support, very important. Government is very open. You know about the ABBA card. We will discuss on this part. Government is also supporting full-fledged infrastructure to develop the telemedicine. Acceptance by people and ready-to-use. This is very important. Post-COVID and during COVID, we have observed that many people accepted this teleconsultation is a paid service. It is not the free service. Previously, we all had experience. People are used to call the doctor and asking the advice, and nobody is ready to pay. Now the scenario is changed completely. They are understanding that you are spending some time with the patient. You are saving their travel time. You are saving their time. Travel time is on consultancy coming to the hospital, so they should pay at sitting at the home. So that acceptance is very important. Prevalence of chronic disease increasing like anything, diabetes, hypertension, cardiac, cancer. You can say a post-cancer, your rehabilitation services, geriatric population on rise. They all need a monitoring. And this monitoring required a very easy tool is a telemedicine. No need to come and rush to the hospital. You can directly contact your consultant. You can take appointment and you can start the race. So this is a huge upcoming new type of the market. And it's a, if you will train yourself, you can able to survive. Otherwise, if you are just in the traditional market, you will not be able to survive. So you must have a complaint that if patients are gradually reducing, you need to understand there are new type of the patient coming online digitally. You need to learn, you need to de-learn first and learn the new technology for this area. Current players in the market of Bharat, see, you have heard something is, or you maybe you are using that Apollo Telehealth services, Practo Technology 1mg, you can say Thyrocare, Cloud Digital, Doc Online Health India, Liberate 3M, Dentsply, Sinora, GE Healthcare, Philips Healthcare, Siemens Healthcare, Fortis Healthcare, Kyokar, Wakard, and ABBA. You know about ABBA? ABBA is Ayushman Bharat Health Account. This is very important. I think now all the insurance company has suggested to their client to open the ABBA ID. So all the record you can keep in the ABBA ID. And this is very important. Doctor can have access your ID and all records, past record, he has access. So this is very important. We will talk this ABBA ID details in some next two of the session, and we will discuss about how it can be helped greatly. Scope. See, this is very important. These are the four main areas where the telemedicine in Bharat has a opportunity. These are the main pillar. Teleconsultation. First, teleconsultation enables the remote doctor-patient interactions. This is very important. I am sitting in the Vadodara city and my work is routinely working at the Chota Udaipur, tribal remote villages. And this is very important. There are the scattered villages having the population around 500, that means 100 houses. You can say just 250 with the 50 houses, and this 50 houses, which doctor will go? Nobody like to go. So everybody is sitting in the city area and still this small population need to support. So teleconsultation, we have to, you can see Uganda and some country of the African countries, similarly like India, they have also difficulty reach area. They also started telemedicine, teleconsultation. The team sitting there somewhere. So our ASA worker, you can say each village has a one ASA worker. They can use they are using the IM Techo mobile application. And that mobile application has a integrated support. There is one more, e-Sanjeevani. I forgot to list out the e-Sanjeevani project of the government of India. You can, I think many of you already registered with the e-Sanjeevani. Otherwise, still open e-Sanjeevani. We will discuss somewhere about the e-Sanjeevani data. These are all teleconsultation services. So remote doctor-patient interaction, providing access to the medical advice and consultation. These are very interesting part, and we need to join. At least each doctor should spend an hour, at least 5 to 10 patients on the teleconsultation, so we can have a very good way of providing equity health services to the all, not just for the urban area, rural as well as tribal and difficulty hard to reach area. Telemonitoring allows the remote patient monitoring, enabling healthcare provider to track the patient parameter and provide timely intervention. Very important. If patient is diabetic, hypertensive, and you are in touch with the patient through, in urban area, many of you must have practicing that Healthify application you are using, and the patient and doctor both are connected with the Healthify, their diet, their blood sugar, their exercise, their yoga, their sleep, everything you can monitor. You can have a manual monitoring with the help of this telemonitoring. Tele-education, role of tele-education in training, educating healthcare professionals. So this is very important. Improving the skill, what we are doing here. Currently, I am delivering a session as a CME on the clarinet, and you are listening here, and that is a tele-education. I am trying to sensitize you, and based on this sensitization, we can create a skill-based module, knowledge-based module, and you can increase your skill by listening, by trying to perform something, and this is the tele-education. Telemedicine, rural remote areas, potential telemedicine to reach the rural and remote area where the access healthcare is limited. So these are really a great upcoming days. See, you must have you must have experience of India's internet speed capacity. With the launching various fast internet speed, everybody, what we are doing, we have a complete 24 by 7 electricity and 24 by 7 internet. It's extraordinary supporting for the telemedicine like this. You can do the consultancy all over the world. Forget about the India. So you can even provide services to the African countries, even provide your expert in the your developed country like US and other also. So this is the scope of this telemedicine, not only in Bharat, at the world. Opportunity. So this is very important. Improved health access. Improved access to the health services, especially underserved population. Cost effectiveness. Cost effectiveness is very important. See, if somebody will call me to come down to the Chennai, Bangalore, or New York to deliver one lecture, and I have to spend almost 1 or 2 days to reach and provide a 1 hour session or 2 hour session. Now see the telemedicine concept, tele-education concept. I can take a session from my room on. I can save my time. I can continue my day-to-day activity and spend a 1 hour in between and deliver the session to anywhere in the world. And that is cost effectiveness. Increase the efficiency in the healthcare delivery. See, this is very important. Enhance the efficiency. We are raising the number of doctors. We are reaching, India is going to produce 1 lakh doctor per year in coming 1 or 2 years. See, this is still doctors are not available in the remote villages. So in this area, we need to change our things. It minimize the travel requirement, optimize the resource utilization. That is very important. Efficiency. Integration with the digital health ecosystem. Integrated with the broader digital health ecosystem, including electronic health record, EHR, and HIE, health information exchanges. We can integrate and we can get a maximum output. Job opportunity for the healthcare professional, opportunity created by the telemedicine, such as a telehealth provider, telemedicine technician, telehealth support staff, new area of the worker. Till date, we are saying ASA worker, ANM, okay, nurse, brother, sister. Now you need to keep in mind we are creating a new scope and opportunity for the job, telehealth provider, telemedicine technician, telehealth support staff. So we are creating a new opportunity. So don't think telemedicine will cut short the job. It will increase a new type of the job. Our current staff need to train themselves. Growth of telemedicine startup, growing ecosystem of telemedicine startup in India and their role in driving innovation, expanding access to the healthcare services. See, lot of startup upcoming. You can see, and you can also do the business startup in this area. Any health, any need, you can contact me. So these are the opportunity. Regulatory, this is very important. Immediately after during the COVID time, everybody started to use the WhatsApp call, telemedicine, WhatsApp, Google Meet, Zoom for the patient consultation. And government also realized there is something is going on. And the Ministry of Health and Family Welfare has immediately released the guideline, regulatory guideline, and they are available on the Ministry of Health and Family website, telemedicine guideline. You can use that, everything, consent, payment, penalties, that everything written in that particularly regulatory landscape. Who are providing, how to provide, what about the prescription, how to write a prescription, how to keep a record, what is the payment condition. They are everything. They are said that teleconsultation is also a type of the consultation. The patient should pay to the doctor. So this is very important. So government is also having a openness in this area, and each doctor who is practicing telemedicine directly or indirectly need to read this guideline. So please read guideline, and any question we can discuss at large in the group. So these are the regulatory landscape guideline. Future trend and prediction. Potential growth of telemedicine market in India. So still we don't have a census since 2011, but very soon post election 2024 के बाद I think government is going to do the census, and it is expected that almost 40% population of India is urbanized, but still 60% is a rural population. And there are a new word upcoming, peri-urban area also, where they are actually having a urban. They are not actually urban, but they are the not rural also. So this needs some modification to understand, but still 50% to 60% population of India living in the remote and difficult area, where they need a support. As a doctor, we should create an environment and support the government ecosystem with the telemedicine to provide the services. Technology advancement. Don't forget, everybody is interested now. AI, MI, artificial intelligence and machine learning and wearable devices, they are upcoming. So don't be afraid of them, but learn them. De-learn something, learn something new, and go ahead. Develop. There are many new opportunity upcoming. Grab it as early as possible. So rather afraid of artificial intelligence, you need to learn, because some mistakes we are making, artificial intelligence is not making. So use, support that, and go ahead with this technology advancement. Integration with the artificial intelligence and machine learning. How telemedicine integrating the AI and ML to enable the predictive analytics, personalized medicine, and automated triage. Very important. Okay, so this function now AI and ML will do. Triage of the patient. किसको जरूरत है, किसको कहाँ जाना है, कैसे जाना है, what to be monitoring. But ultimately, this doctor-patient relationship cannot be transferred to the machine. They need a human being. So don't worry, we are changing the pattern, but our services are always required. Don't worry, don't afraid. And with the telemedicine and new area learning, you can keep your hand positively upside, but learning is very important. So this is a future trend prediction. We need to learn, we need to update it, and we need to go ahead. So this is something about the first session, my first session on the telemedicine scope and opportunity.